So, welcome to this Health Knox episode. This episode today is called Trust Your Gut, Healing and Restoring Health Through Your Gut. I do have my guest with me, Dr. Brooke Kirsten, and she will kind of introduce herself briefly here in a second, but we're going to cover everything about Gut 101, some signs and symptoms you might have a gut issue, and then a real easy takeaway home action plan of how to start healing and restoring your gut protocol, and even the next step of maybe a progressive in-depth protocol that you may need. So I'll turn it over real quick to you here, Brooke. Just introduce yourself and what your focus, passion is about, and then we'll kind of jump into these details.
Thank you, Dr. Trent. Yes, my name is Dr. Brooke Kirsten, and I am a colleague of Dr. Trent's. I specialize in correcting blood work through nutrition and supplementation. And so with that comes gut health and the importance of it.
Perfect. And let's kind of just jump into the 101 of gut health. So, what should people know about gut health? Maybe some frequently asked questions, misconceptions that you've come across, and that people are always interested and really probably blown away that they didn't know about how the gut is such a interconnected force with our health.
Yeah, great way to word it, Dr. Trent. So the gut impacts our overall health in so many different ways. And I would just like to give you like a snippet of some of those connections today. There is a gut metabolism connection, meaning if you get constipated, have diarrhea, get bloated, abdominal pain, have gas, that could be an indication that you have an overgrowth of bacteria in your gut that needs to be corrected. There's also a connection between your gut and your thyroid. It has been shown in studies that if you have been diagnosed with H. pylori infection, which occurs in the stomach, treatment of that can decrease thyroid autoimmunity. There is also a connection between your gut and sleep. It has been showing that insomnia can be resolved by decreasing inflammation in your gut. There is also a connection between the gut and your hormones. If there is high inflammation or an overgrowth of bacteria in your gut, that can affect how your hormones are functioning. So sometimes people will correct gut health and they'll see a change in their progesterone or testosterone. There's also a connection between your gut and your skin conditions. So sometimes people will maybe remove some inflammatory foods from their diet and decreasing the inflammation in the gut, and their skin conditions improve. What else can I say? Of course, the big one that everybody talks about is the gut-brain connection, right? They talk about how the gut is really the second brain. So I personally have seen in patients corrected the gut and have seen like anxiety and depression symptoms improve. So those are just a few connections of how the gut is truly related to so many different systems in the body.
Yeah, there's another one I wanted to briefly just bring up because it has a connection personally for myself, but also it makes sense when you understand the design of the body. But gut health also has a connection for many different internal organs, such as like your kidneys.
Yes. Great point, Dr. Trent.
So it's really interesting with all the people that you've helped, patients and clients. What are some common top 3 or 5 symptoms that are probably definitely hit on the nose of, hey, this is probably, we need to investigate your gut health and we could help you?
Yeah. So constipation
Okay.
is a big one. You should at least be having one bowel movement per day. And having, one bowel movement a week or two bowel movements a week is not normal. So
Mm-hmm.
that would be considered constipation. Diarrhea or loose stools is another big indication that your gut health is not balanced. And bloating, if you get bloated after meals or just get bloated at random times of the day, that's another sign that there's an imbalance in your gut. How many did you say for me to list, Dr. Trent?
I don't know, 3 or 5, whatever kind of. I think you hit
Yeah.
the.
And then I think too, another big one though that I see is abdominal pain. And that is often an indication that there's an overgrowth of bacteria in the gut. And that can be determined with testing and taking a history of the patient.
Now, is there a timeline? So the average person might have something like this going on maybe once or twice a week versus this is more of a consistent thing like happening, I don't know, more frequently or consecutive days in a row. Is there kind of a tall tale sign when you look at somebody's history of this is definitely a gut issue?
Well, I believe that we live in a world where we are constantly being exposed to toxins.
Mm-hmm.
Everything from the Western diet that we eat to the chemtrails in the air to the toxins in our clothes and our furniture. Like we're just surrounded by toxins. Those toxins then in turn affect our microbiome, which part of that involves the bacteria in our gut.
Mm-hmm.
So whether you're at the beginning of dealing with those symptoms or you're in the flow blown stage of it, I think we always have to be bringing diversity to the microbiome. And that is part of the process in how we can eventually correct gut health.
So my next question would be for those who are interested, um, how in general, how easy or hard, and this could be a loaded question, how easy or hard is it to um, identify and then correct gut health?
Great question. So I'm definitely a practitioner that likes to start simple and move forward from there if need be. So I think the first thing that I would do if you feel that you are having gut issues is do an elimination diet.
Okay.
Some of the biggest culprits for an imbalance of bacteria in the gut or things causing inflammation in the gut are dairy, soy, gluten, and eggs. So pick one of those foods. Let's say you start with gluten, eliminate it for 2 to 4 weeks,
Mm-hmm.
and see if you notice any changes. A lot of people that have a gluten sensitivity, they'll eat gluten and then they'll feel like they need to sleep or they'll get this like brain fog. And if they eliminate it for 2 to 4 weeks, it's usually around that 2 to 3 week mark that there's a shift in the body.
Mm-hmm.
And that is when the body is going, okay, that inflammation is not constantly going up every time you feed me gluten because it's been eliminated.
Mm-hmm.
Now, keep in mind, that doesn't mean that that inflammation is going to be resolved in 2 to 4 weeks. That's going to take a few months to do. But if you do find at that mark or somewhere around that mark that you have felt that shift, you know that you're probably gluten sensitive.
Okay.
Then you can do that with dairy and eggs or whatever you feel are the foods that are triggering it. Cheap, easy to do. Anyone can do something for 2 weeks, right, Dr. Trent?
Yeah, absolutely.
Yeah. So, and then, if you want to take it a step further, of course, there is testing that you can do. There are labs that you can get done, and that's where I would recommend it getting connected to a functional medicine practitioner who would take a complete medical history on you and then could do some testing from there. That kind of testing might look like, you know, testing for SIBO. Is there an overgrowth of bacteria in my gut? It might look like testing for food sensitivities like the IgG or the IgE, different things like that.
So when you bring up sensitivity testing, kind of give us a little bit brief analysis of value of in terms of like best, good, and okay in terms of tests. Like I know there's blood tests you can do, there can be hair samples. So what are some of your criteria of like, hey, here, this is the gold standard that we would shoot for, and then the next best, and then the okay down here, I wouldn't waste your time doing this one or whatever?
Well, yeah, I think first that would depend on taking the medical history, right? And then meeting the patient where they are, right? One thing that, we have to keep in mind is like, if we're taking like an IgG test and an IgE test, the IgG tests are not standardized across every lab. So you might get it done at one lab and then get it done at a different lab, and the results might vary a little bit.
Mm-hmm.
However, the IgE lab tests are standardized across all labs. So again, that's where I'm like a big proponent for body awareness. You have to learn what your body is telling you and listen to it. Don't ignore what it's telling you. Makes sense.
So some things that you would recommend if somebody were to go say, hey, I'm interested in this because I have some of these symptoms, whether they're excessive or chronic or acute, happened last month or it's been going on for many years or months. If someone were to come to you, well, I guess before we go to that point, let's kind of just talk about any more things you would add in there. So you said elimination diet, try that for 2-3 weeks of some of the common things that most people are allergic to or have inflammation markers from. And what would be the next step after elimination diet? If that wasn't working, that would be to find a functional practitioner such as yourself. Is that correct?
Yes, and then we could move forward with the testing.
Okay.
Another thing then beyond the medical history, right, is just like, I think you need to ask yourself, okay, have you ever taken antibiotics? Do you take Tylenol on a regular basis? Have you ever taken birth control pills? Like, do you eat a processed, food diet? Those kind of things can affect gut health as well. And in particular, I'm talking about leaky gut. And so that's another thing that needs to be looked at as well, right?
Mm-hmm.
And then we could say, okay, well, leaky gut is where there is this paper thin wall that surrounds the intestines. And when we take antibiotics, birth control pills, eat the processed food, whether it could even be the wheat or the gluten, little holes get into that paper thin wall. And then that food, those drugs get into the bloodstream. And that's when we get this perfect storm called leaky gut, which then in turn affects your immune system, right? So, I mean, what could be symptoms of that? Symptoms of that could be bloating. Symptoms of that could be like, oh, you know what? Like, I feel like I have this slight cold coming on, but it never maybe really truly exacerbates, right? So leaky gut is something that's very common in our Western world, and it is something that can be corrected through diet and supplementation as well.
So a lot of the things that I hear, and of course, just background of knowing and teaching, just like you, is it's environmental factors that change the ecosystem of our body, right, in our health, because that's really what our health is an ecosystem. And if you're fertilizing the soil, almost think of that concept for your gut, you're feeding it things that are live food, that are healthy, it's going to cultivate more of health of what you're designed for. But we have a lifestyle today that's very convenient, very processed, high calorie, low nutrient density or low nutrient value. And so the body is really, in a sense, starving for nutrition. So that's where
Yeah.
deficiencies come in. And
Yes.
then we're taking in things that the body doesn't necessarily need. And so that creates a toxicity level to some degree. And then we're just repeating that over and over again. And here we are with, said, symptom or collateral problem and wonder why, right? And so what I hear is we can really change this through simple steps of first identifying what's going on. If this is the problem, then here are some of the solutions. So let's finish up here and talk about, is there anything else you want to talk about? Like if somebody wants to do work with you, what does that look like? Is there a process? Is there certain patients or clients you like to work with? So I'll kind of open that up to you just in case people are interested in what's the next step.
Oh, thank you so much, Dr. Trent. Yes, so if somebody is interested in working with me, they can just put something in the comments down below and I will get in touch with them. And that process looks like first we hop on a phone call and have an initial consultation where you see and I see if we're a good fit for each other. And if then we decide that as a team, then we move forward with the next steps in whatever your health goals are. One thing that I would like to say as well in regards to gut health and probiotics is if you are taking a probiotic, you cannot take the same probiotic month in and month out. We want to create diversity in the gut. And in order to do that, you have to have different strains coming from those different strains of bacteria coming from those probiotics. So if you are taking the same probiotic 6 months in a row, you're completely saturating your gut with those strains of bacteria. And that too, in of itself, will cause an unbalance in gut health. So diversity is key. I think we need to treat our microbiome as another organ, just like we would our heart and our liver and our brain, right? And give it the care and the love that it needs. And my mentor at Systemic Formulas, Dr. Shane Morris, has created some probiotics that I personally feel are top of the line right now. I don't feel like anything can touch it. And he says that if you're taking a probiotic, you need to have a prebiotic fiber alongside with that because the probiotics feed off of the prebiotic. So, yeah.
I think you hit a lot of good nuggets there. Real quick, I'll just mention that even as the practitioner myself and knowing all this stuff with gut health, it's not talked about of like, hey, you need to be switching up your probiotic, every 30 days to create diversity. It makes so much sense. But I mean, these companies and individuals who are saying, hey, you need a probiotic, I think most people kind of understand that to some degree. They didn't know that, hey, there's a little bit more in-depth detail. Otherwise, you're creating too much of a good thing, which then creates an imbalance and creates potential problems, which I think is frustrating for people who, don't spend their life and passion like we do looking at health and researching this stuff. So they're like, hey, I just know I need to do this. I'm doing something good. And now I know that I'm doing something good that now is producing a problem for myself. And it's like, it's a double-edged sword. So I think that's good information. And then once we kind of get the gut healthy enough, we then can get to a place where we can kind of maintain that and really focus on those environmental factors, right? So certain foods and quality of foods. And you can even reintroduce some of those things that have been a problem down the line, correct?
Yes, absolutely. I mean, just my own personal experience, about 10 years ago, I developed a sensitivity to eggs. I was eating them every day, and that sometimes can be detrimental too, right? And then B, I had some issues going on in my gut that needed to be resolved. And once I corrected those imbalances in my gut, again, it was just an imbalance of bacteria from lack of knowledge, not understanding that I needed to rotate probiotics every month. I was able to reintroduce eggs into my diet and do fine with them.
Great. So lastly, what I'm going to do for those who are interested and have watched all the way up to this point, I'm going to leave, I'm going to put your email up on the screen here, Dr. Brooke.
Mm-hmm.
So you can contact Dr. Brooke. This is her email address that you should see pop up. Also, if you're watching this, because I'll post this into our Facebook group called Your Extraordinary Life, West Knoxville. You have access to Dr. Brooke there. She's one of our experts there. You can ask her anything. You can probably message her privately if you wanted to, but I want to thank you, Dr. Brooke, for being just a wealth of knowledge, especially on this topic that I always find so fascinating, and also is such a great addition and connection with, the spinal health and the correction and restoration process that we do in our office in chiropractic. So thank you again, and I look forward to having more in-depth conversations with you in the future.
Thank you so much, Dr. Trent. I enjoyed it.